and clients after discharge from hospital, especially at this time. All right, I'm going to change. My slide is not moving. Okay. So first, we want to know the COVID status of our clients before discharge so that we know what to do if there's going to be any special follow-up, if they've got symptoms or not. So you need to find out before discharge when the date of the test and the results of the test. The date of the test matters because if they've had symptoms from that time or before, then the clock for the 14 days would have started well before on the day they were tested, or maybe before they were tested, once the symptoms have started. So we also need to know when the symptoms started, like I said, for the clock. And the care plan in terms of isolation and supporting the person if they are COVID-19 positive. So also arranging the care before they leave hospital. Oftentimes, or most times, the hospital liaison nurse would be aware that the person is in hospital. So before discharge, the liaison nurse should be informed. Obviously, the carers should be informed. I say should because experience shows me that sometimes, especially those in nursing homes, the clients are actually discharged and on their way home before the care home is informed, so that it's not in a timely manner, and therefore, if there's any extra support that is necessary, the home will not be able to put it in place before the client arrives. Yeah, and then, like I said again, the person must be tested before discharge so that whoever is receiving them would know what to expect. Also, the person must be medically fit for discharge. I mean, I think things are a lot better now, but in the beginning of the COVID-19 crisis, people could be discharged because they needed to free up beds. So you need to make sure that the person is actually medically fit for discharge. So if the person is COVID-19 positive, the carers, the care provider must have the isolating facility in the premises. Otherwise, you can then begin to discuss respite for the person if the home hasn't got that isolating facility. Isolating facility, I mean, is having a separate room at least for the person. Someone is telling me that my audio is very low. I don't know why that is. I've got it on 100 where I am. Yeah, so the extra support needed for that person should also be discussed with the carers before discharge, and where necessary, an assessment can be carried out to find out the new support or the extra support the person needs, and that any adjustments required should really be put in place before discharge to prevent readmissions. Also, like I said, some people are sent home on hospital transport. So whoever is transporting the person should be made aware of the COVID status of the person they are transporting, so that the guidelines are put in place to safely transport the person home. Trying to go on to the next slide. Right. Right, it's not happening. Okay. Yeah, that's it. So, if the person is going to be discharged with COVID-19 positive, please discuss with the hospital. If it's not a care home, I know that care homes, care agencies have their own PPE, but if they're going to be discharged to their private homes with family, please discuss with the hospital on how you can at least have PPE for immediate care and how to get repeat supplies. I'm looking at this as things like medication to take home. So at least for the first few days, there should be PPE supplied to yourselves, and how to get repeat supplies also should be discussed with you if you're the private family carer. Also, the contact details of where to get the supplies needs to be discussed with you, because once the person is discharged from the hospital, it might be difficult to contact the ward again. Onward referral, so services to follow up the person in the community needs to be discussed with the client and the carers, and the details should be provided. So, for example, if they're going to be referred to maybe district nursing, you need to know which team, but that goes through the GP. But if you didn't know that, you need to know how to get in touch with the district nurses when that person has been discharged. So, if the person is being discharged and needs to be in isolation at home, you will continue to provide the necessary care. So the client needs to stay in the isolating room, even for meals. They shouldn't be sitting with the rest of the group in the home at any time for 14 days from when the symptoms started, or from when the person was tested positive. We say that because not everyone will show the symptoms of COVID-19. All carers should wear protective equipment, the PPE, and make sure that this is disposed of immediately in the clinical waste bin. So again, if for care homes, I'm sure they would have their own clinical waste bin. And if it's a private carer, then the hospital will explain to you how you can improvise. I think it's just about double bagging it, the waste. So discuss that with the hospital before discharge if you're a private carer family. Protective equipment also depends on what sort of intervention you're going to provide to the person. So if it's personal care, then you know the full kit to wear. And if it's just going into the room to interact with the person, then obviously the PPE is slightly different. So continue to monitor the health of the person, so especially with temperature and new persistent coughs. So those are the clear signs of um, COVID-19. It could be something else, but those are clear signs of COVID-19. Uh, General infection control measures must be maintained at all times, and especially and including frequent hand washing. Regular monitoring of the health of the other residents also should be done, because we know it's a transmittable disease, infection, and just contact the GP for support where necessary. Communicate also with the person about social distancing, making use of easy read information where necessary. Easy read, it could be pictorial, it could be the person's sign language. Staff should also ensure that they are monitoring and managing the emotional difficulties, because at this time there will be a lot of emotions running, either because the person's activities have been disrupted. If it's someone who goes to college or to day activities, to group activities, this will be disrupted. And if they haven't got the understanding of the details of why they can't go to their usual activities, then that can be a problem to the carers. It could be bereavement, maybe somebody within the home or within their network has died, or maybe because they can't even see that person because of social distancing. So also we know that conditions like the autism can affect their understanding of why their activities have been disrupted. So points to remember, we know that people with learning disabilities may be less able to report symptoms because of communication. So it's about monitoring our clients, finding out what's changed and why their mood has changed. It could be process of elimination if it's somebody who's not verbal or cannot express themselves in the way that we can immediately understand. So it's a process of elimination. Yeah, using all other forms of communication personal to them. So staff and carers should be alert to the presence of the signs and symptoms of COVID-19, like I said, especially with temperature and new coughs, new and persistent coughs. Understanding the behavioral response to illness, pain, and discomfort, like I said, it's about knowing our clients and what's changed in them. So trying to communicate with them about protective clothing. Sometimes, for example, when I've had clients in during this time for their injections, I let them see me as I am, and then I begin to wear the PPE before I get any close to them. I begin to put on my PPE by the time I finish wearing it. So, and if there's any problem, I'm from the Redbridge Learning Disability Nursing Service. So that's the contact details of all of us. I mean, we've put our names to localities, but we do work across the borough. So just get in touch with us for any extra support. And for referrals, for clients who are not already known to us, you go through the first contact team, and that's the website to get the form from. And that's me done. Thank you for listening, and just send in your questions and we'll try and answer them.